Good afternoon, everybody. It's been a bit of a discussion on UK podiatry about eucalyptus oil for onychomycosis, and a study was posted, which I think was from JFAR, which seemed to conclude that eucalyptus oil was good and did work and was worth using. I think there are some problems with that conclusion from this study, from this data. So just in the interests of sort of how we can approach data, I thought I'd just run through the study briefly and talk about why the conclusions are maybe not justified. I'll try and put the study in text, everything up there somewhere, or down there possibly. The study was a longitudinal prospective study, which means that they knew what they were doing beforehand. They got 70 people, or 70 toenails I should say, 70 fungal toenails, of which about half were proximal infection, which is down there. Again, I shall try and put a picture up. And about half were the distal, how was it they described it? Distal lateral. So on the outside clip, the outside edge of the toenail. And two toenails were superficial white onychomycosis. That is the very top layer of discoloration and infection that you get sometimes. They used eucalyptus oil, assessed weekly for 4 months. 4 months is a pretty long time. Most studies you're going to want to start seeing some results in that time, so it's not like they just did a very quick snapshot and expected it to get better instantly. The conclusions of the study, I'll read the conclusions out. Topical eucalyptus oil is more effective as an antifungal treatment for fungal infected toenails without nail matrix infection. Eucalyptus oil may prove an acceptable and cheaper alternative to prescription topical antifungal agents for people with superficial white OM or distal lateral OM. So the conclusion is, it sounds very positive. The conclusion seems to be that yes, you could use it as an alternative, which suggests a degree of some parity there to me. But if you look at the results, I don't really think the results justify that conclusion for me. So let's look at the results. Nails with superficial white onychomycosis were found to have an 86% clearance of infection after 4 months. 86% after 4 months clearance sounds wonderful, until you look at the detail of that and you see that this is n equals 2. There were 2 toenails that they got 86% clearance in. Now, if we're talking about 86% of 2 toenails, we're obviously talking about surface area. Superficial white onychomycosis is that stuff that you can take off with a burr. You can actually physically debride it off very, very easily. And in all the other fungal preparations, it's the easiest thing to treat because it's just sitting there right on the surface. It's the stuff that Exilor works pretty well on. Exilor is basically acetic acid. It's a medical device. It's not technically even a medicine. So to say that you can get 86% clearance of 2 toenails is really not all that much of an achievement. But then we look at the other types of toenail, the deeper infection, and it says that 1/3 of all nails with distal lateral subungular onychomycosis demonstrated a zone of clearance. What?
Mr. Macaque's on the phone.
Mr. Macaque is not on the phone for me. My colleague is trying to be amusing. Go away! I can't do it with you watching, it's weird.
You're weird.
You're weirder. Completely lost where I was. What it said was that 1/3 of the nails with distal lateral OM demonstrated a zone of clearance. A zone of clearance just means a bit of nail that's no longer infected. So if we think about what we're actually saying there, 1/3 of nails showed some zone that seemed to be less. That's it. 2/3 of them, therefore, by inference, showed no change. Now, it's very hard to compare. Usually if you've got a study like this, we want to compare it with the studies on other products. It's very hard to do that because most of the studies for things like terbinafine are looking for mycological cure. They're looking for getting rid of the infection. And they might say, 30%, 40%, 70% of nails had a mycological cure. This is talking about 30% of those nails had an improvement. just 30% of nails had a little bit of fungus that was less after 4 months of this stuff. That's a very modest improvement. The proximal subungual onychomycosis was 50%. So again, half of the ones with that had some improvement, half of them had no improvement. Now, obviously, fungal nails can be a bugger to treat, and that's reflected in the success rates for other therapies. But when we're talking about 2/3 of a certain type of infection having no improvement whatsoever, 1/2 having no improvement whatsoever, I think to say that it's an alternative for me is stressing the case when we've got terbinafine, which is much more effective in the literature that we do have, and it's safe, and it's tested, and it's in the BNF. It mentions in the conclusions that eucalyptus oil may be a cheaper alternative. Well, we're looking at the difference between £2 and £6 for our patients. So when a patient comes to you, I would think that is not enough to make it justifiable to offer a treatment which is so much less effective. Interesting study. It's good that this sort of thing is carried out because the data is actually useful. But I just think there's a massive non sequitur there between the actual data, the results, and the conclusions. And eucalyptus oil, not really.